Hi everyone, my name is Nicollette Gooding. I am a Master's of Social Work student at the University of Toronto, currently completing my practicum with For a Safer Space. Today I will be sharing information around trauma in the violence against women sector and how it can affect us and also those in our lives. So trauma is a term used to describe the challenging emotional consequences that living through a distressing event can have for an individual. Traumatic events can be difficult to define because the same event may be more traumatic for some people than for others. Research has shown traumatic events can result in serious stress and detrimental consequences for survivors who are women and their families. Approximately one half, so 50% of all individuals will be exposed to at least one traumatic event in their lifetime. Although the majority of individuals will be able to absorb the trauma over time, many survivors unfortunately experience long-lasting effects. Approximately 8% of survivors will develop post-traumatic stress disorder, and many survivors currently living with PTSD experience symptoms such as nightmares, insomnia, somatic disturbances, difficulty with intimate relationships, fear, anxiety, anger, shame, aggression, suicidal behaviors, loss of trust, and isolation. Psychological disorders may also occur in conjunction with PTSD, including depression, anxiety, alcohol, and substance abuse problems. So a traumatic event can be a recent single traumatic event such as a car crash or even a violent assault, a single traumatic event that occurred in the past, such as a sexual assault as a child, the death of a spouse or a loved one, an accident, or even living through a natural disaster or war. It could be from a long-term chronic pattern, such as ongoing childhood neglect, sexual or physical abuse. And a person who has experienced a traumatic event might develop either simple or complex PTSD. Experiencing a single traumatic event is most likely to lead to simple PTSD. Complex PTSD tends to result from long-term chronic trauma and can affect a person's ability to form healthy, trusting, long-lasting relationships. Complex trauma in children is often referred to as developmental trauma. Research indicates that women are twice as likely to develop PTSD, experience a longer duration of post-traumatic symptoms, and display more sensitivity to stimuli that remind them of their trauma. Although women are at greater risk for negative consequences following traumatic events, many often hesitate to seek that mental health support. Survivors often wait years to receive help while others never receive treatment at all. Untreated PTSD symptoms not only have tremendous mental health implications for women, but can only lead to adverse effects on their physical health as well. Female survivors may encounter physical symptoms including headaches, gastrointestinal problems, and sexual dysfunction. Although the mental and physical symptoms of PTSD can be quite debilitating, trauma is often undiagnosed by health professionals due to the lack of training, time, and resources. So why is trauma-informed care important? Violence is pervasive in society. For example, globally, 1 in 3 women experience or will experience some form of physical or sexual violence by a partner. And in Canada, 32% of adults report that they have experienced abuse in childhood, and 25% of students in grades 6 to 12 report being bullied. Because of this, many people are seeking services and support, whether it's in healthcare, housing, justice, or other systems, and they will have histories of violence and trauma. The goal here is to minimize the harm, not to actually treat and invalidate and disregard the trauma. Trauma and violence-informed approaches are not about treating the trauma through counseling or chronic pain interventions, but instead, the focus is to minimize the potential for harm and re-traumatization and to enhance safety, control, and resilience for all clients involved within systems and programs. These approaches benefit everyone, whether or not they've experienced trauma in their own personal lives and whether that is known to the service providers themselves. So recommendations: support increased funding for research for women and their trauma. This could include things like increased studies, models for prevention and early intervention, developing and evaluating assessment tools to better detect women's trauma, develop better evaluation tools, and also look at the prevention of intergenerational consequences of trauma. Another recommendation is to support increased training regarding women, trauma, and their abuse. This would include for mental health professionals and medical personnel, school personnel, specifically teachers, administrators, law enforcement, as well as juvenile justice personnel, advocates, children, parents, guardians, and caregivers, community agencies, and Native and Indigenous rural professionals. Lastly, a recommendation would be to overall enhance services. This would include creating prevention and early intervention programs, systemic trauma screening, creating integrative systems of care, as well as primary care collaborations, look into building school-based programs, community outreach, parent-child interventions, as well as developing case management. When it comes to diagnosing and treating trauma, there are some common approaches that all vary depending on the specific individual, as it's important not to provide each and every client a cookie cutter approach. More generally, patients often benefit greatly from treatment approaches that are trauma informed. Trauma informed care refers to therapeutic approaches that validate and are tailored to the unique experiences of a person coping with their specific trauma, as well as experiences of possibly PTSD. And it understands the symptoms of trauma to be coping strategies that have developed in recognition to their traumatic experiences. So, non judgmentally, it recognizes that a person with PTSD may have possibly behavioral, emotional, or physical adaptations that have developed in specific response to their overwhelming stressors in their lives and experiences. If you or a woman you know has trauma and is seeking support, calling your local mental health center and inquiring about trauma informed anti oppressive service can be a first step in the journey towards healing and fulfillment. Thank you for taking the time for watching this video. I hope it was helpful, and take care.